Imagine a private practice where you get to see your best patients every day, providing medical services you truly enjoy, all without the hassle of insurance. My name is Dr. T. Nguyen, and I'm a recovering specialist who was completely burned out from insurance-based medicine. I pivoted into direct care, where patients pay me directly for my medical services and have never looked back. If you're a private practice owner or planning to become one who's looking to be free of the grind of insurance and you're craving simplicity, efficiency, and connection with patients, you are in the right place. This podcast will help you map out your exit plan and uncover the mindset needed to thrive in today's economy. Welcome to the Direct Care Podcast for Specialists. I thought I would talk a lot more about Medicare beneficiaries in this episode. The question of the day: do people who have Medicare want to pay out of pocket for medical care? This is a different question from asking, do they pay out of pocket? And if they do, when? This is going to be a fun topic for me and for you because most of my practice before I left insurance was predominantly Medicare folks. Medicare and Medicaid, so state-funded and federally funded programs was the majority of my revenue. So stepping away from that model was very scary and I didn't know what to expect. But here's the thing, if I've been able to do this after, I think it's been 3 years from leaving my biggest payer, I think you can too. Here's some reasons to why you might want to consider a direct care practice. So let's talk about who is Medicare eligible. I talk a lot about knowing who your ideal client avatar is or the person you're serving. In my course, I go into detail about what that actually looks like, but let's just, for generality's sake, we're talking about serving people of Medicare age or who are Medicare eligible. And those individuals are people who are 65 years and older, and they have paid into Medicare taxes for at least 10 years through their job or through a spouse. There are people who are younger than that who have Medicare, tend to be those with end-stage renal disease, ALS, or they just have an eligible disability. So I do sometimes get younger people on disability who have Medicare. So that covers the type of person who may have Medicare as their health insurance. And there are situations where there are specialists who are opted in Medicare, but they can still bill the patient a cash price because they're providing a non-covered service. Just think about all of those people who are seeking aesthetic procedures, plastic surgery, those who are in the musculoskeletal arena doing orthobiologics, things like PRP injections, sexual dysfunction, that kind of stuff. A lot of these products that they use are not covered by insurance, and so that's the core of their practice. There's also things like functional medicine, preventive care, and so on. So there is a very long list of reasons for those who have Medicare insurance are still paying out of pocket. There are guests who have spoken on this podcast who work as a hospitalist, and so they still have to be opted in to have that kind of a job, but their outpatient clinic is predominantly a non-covered service, like one of the ones I listed above. And there are other situations where a physician might have a non-clinical role where they are employed separate of their clinical role, and they have this outside clinical practice where they can bill the patient directly, even if they're still opted in Medicare. Now, there are some things to tease out in this situation, and a full disclaimer, I am not a healthcare attorney, so you really do want to seek out one in your state who would know the law much more as to what you can do and what you should not be doing. To clarify, what you should not be doing is trying to create two separate entities, thinking that at one entity it's covered by insurance and then the other entity or LLC or INC, the business entity, you can bill cash. That's not how it works because you, the physician, have one NPI, so no matter where you practice medicine, whether it's in one clinic, one hospital, one facility, you're still bound to Medicare rules. You still have to bill Medicare patients if you are contracted with Medicare and you're seeing them wherever you're seeing them. So you can't divide the line and choose who you're going to see and who you're going to bill cash for. That's illegal. And then there's the rest of the direct care community who is fully opted out of Medicare, and they still see Medicare beneficiaries. People like plastic surgery are doing it, rheumatology, acupuncturists, chiropractors, people who provide pain relief. I even know a neurologist who specializes in Parkinson's disease, who is exclusively specializing in that demographic, who are making this work. So why does the aging population matter in direct care? To be very clear, Medicare offers some things, but they don't offer everything. What we see happening within the Medicare system, those doctors who are taking Medicare, is that those doctors are very, very busy. And oftentimes those appointment slots are extremely rushed. They're very short. There is some fragmented care because those visits are so short, and they're having to see 30, 40, 50 people a day. And there is difficulty for these individuals to access preventive services. It's very hard to have longer conversations with people about lifestyle changes in the insurance model because they're kind of crammed for time. They have to see a lot of people, which means the doctor has to be very efficient in what they treat, one problem per visit, and then it's another appointment. And then realize that the demographic is really shifting because people are living longer, and those who are living longer need a lot more specialized care. So the challenges that Medicare beneficiaries are currently facing, again, short appointment times, reactive care, only come when something bad happens. These are individuals who have complex medical needs. They are getting older. They are taking a lot more medications, sometimes duplicates of medications, polypharmacy, because they're seeing all these different specialists, and there really isn't one person to help consolidate their medical care, so it's fragmented. And then that limited attention on preventive care again, and overall wellness is just not there in the insurance model. So how does direct care fill the gap for these individuals? As you may already know, direct care offers longer appointment times. On average, we are spending 30 to 60 minutes a patient for both acute and preventive care. We also offer continuity of care, which means a closer relationship between the physician and the patient. Oftentimes, patients have direct access to the doctor with just a phone call. A lot of us give our cell phone numbers to our patients, myself included. That doesn't mean they take advantage of the number. They just know that if they need something, they'll know we'll be there. And then we physicians need to create the boundaries of what that really means. So I'm very clear about telling patients I am available at the next working business hour. And so I define what those hours are, and rarely has anyone ever taken advantage of that. These are very respectful people who know you're busy and who expect you to respond during working hours too. That's a working relationship. Direct care also helps focus on the quality of life with preventive strategies. So we talk about lifestyle changes that is tailored to wellness. People want to age better. They want to age in a healthy way. They just don't want to live long and be decrepit and dependent on other people. These are people who want to maintain their independence, and that's where we can help. Direct care also offers a time to educate patients on how to navigate their health care, their health insurance, and the entire ecosystem of health. And that includes giving options that are outside of what insurance covers. So ultimately, direct care is complementary care, and it also provides caregiver support. Imagine having enough time to not only talk to your patient, but to the people who take care of them, their spouse, their family member, caregiver, their network, and without having to struggle to find time for that or trying to figure out, is that a billable hour? It's all just incorporated into the visit. And with all of that access with the patient, without having any additional interference, you're able to build trust much deeper, much faster, because you're able to offer transparency in what you do offer and what you don't offer. And most importantly, the price of what all of that costs. Patients are going to want to know, can they still keep their Medicare insurance if they chose you as a direct care doctor or a direct care specialist? And it's important to inform them, again, what you can do and what you can't do. So the answer is yes. Patients can still access a direct care doctor and keep their Medicare benefits because we offer complementary care. I like to say that I fit the jigsaw puzzle within my community. There are things that I love doing that my counterparts don't love, and vice versa. If there's something that requires more resources that I can't offer, I refer to my colleagues in town. It's symbiotic. Patients are definitely going to want to know what is your service as a direct care doctor going to cost them. And I've seen prices anywhere from $50 a month per person up to $15,000 for one procedure. So it really depends on what your specialty has to offer and how you convey that value to your ideal patient. And realize you're not for everybody. I think that's the most important part about direct care, is realizing you're not just the pit stop for everybody's problem. It's better to niche down to the few things that you are excellent at and then charge more for that. People want to go to a specialist. If your car is busted, you probably want to go to a specialist of your car type rather than a generalist. Same thing with medicine. People want the specifics. They want the nuances of specialty care. And that's how we're able to charge as much as we do. And lastly, your Medicare patients want transparent pricing. They already get all of these different bills as they get older. There's a lot of confusion around secondary insurance, what their copays are, what their deductible is, and all of the hidden costs with having health insurance. And you might be the one to help clarify those things for them if you wanted to. You don't have to. I don't do that. But you could be a resource for them if this is your patient population. So if you want to even clarify what the unexpected expenses might be if they don't manage their medical problems preventively, and you want to draw a graph what the cost of catastrophic care could look like, that might help them make the decision to be more proactive about their preventive care services through a direct care doctor. So the key takeaway here is, yes, Medicare patients and beneficiaries will pay for direct care if they are looking for efficient solutions, if they're looking for aesthetic care, things that aren't covered by insurance anyway, or non-covered services, and preventive medicine. Those are just a few of the categories of things that direct care can offer. So if you're just kind of thinking about how you can craft your perfect practice, those are some ideas, some paths that have already been paved. And you just gotta find your mentor to help you figure out what your next step is. And I have seen direct care doctors loving their practice again because they're no longer tethered down with the stress of an insurance-based practice. So my conclusion is, if direct care doctors love their jobs, they stay in clinical practice. They don't burn out, and patients get to have better relationships with those doctors, which means those patients get a better support network. If all of the doctors burn out and we all leave clinical practice, or we stay in clinical practice but we are resentful about the service we provide, patients are not going to get the best medical care possible. They're going to get, again, fragmented care, discontinuous care, and they're not going to connect with their doctors, and thus they're not going to get well. They're just going to get reactive care. They're going to go in and out of that revolving door. So if you're wondering about those who have Medicare, if they are going to pay out of pocket for direct care medical services, realize they already are, and some of that comes from unexpected expenses from having insurance. Now, wouldn't it be more kind to offer them transparent pricing so that they can financially prepare for those expenses? Being honest and clear about what you charge is the kindest thing a doctor has to offer. It's better than the alternative, ordering a bunch of stuff, not realizing if their insurance pays for it or not, assuming the patient understands their health insurance and saying, well, that's tough for them. I don't think that's fair on the patient. Doctors have better insight about what goes on in healthcare, and we can be their advocate to help them make smart decisions, smart financial decisions, and smart medical decisions. I think that's the kindest thing that we can do as doctors. So I hope you take away from this episode that yes, you can absolutely take care of those Medicare age patients, that you are offering gap care that they can't get with their insurance options. And I hope that gives you a vision as to what you can craft as your dream direct specialty care practice. I hope you enjoyed this episode. Let me know if you do. Let me know if you don't. Either way, I'm so glad that you're here. I'll catch you next week. Take care. If you enjoyed this episode, please give it a review and share it with a friend so more doctors can learn about direct care. Let's keep the conversation going on LinkedIn so we can help more doctors escape insurance and thrive in private practice. Thanks for listening. I'll talk with you next time. Take care.